This lecture is going to be on Chapter 59, IGI, Care of Patients with Problems of the Biliary System and Pancreas. This diagram here shows organs of the biliary system and the pancreatic ducts. You can see the pancreas here in the middle, the gallbladder, as well as the common bile ducts, and the liver. Sphincter of Oddi is there between the common bile duct and the duodenum. And then you can also see the stomach. The biliary system includes the pancreas, liver, and the gallbladder. All of those secrete enzymes and other substances that promote food digestion, and that's going to be in the stomach and the small intestine. If the biliary system isn't functioning properly, then a patient is probably going to have impaired digestion, which could lead to impaired nutrition. I have your learning objectives here on a slide. And then this is a diagram of the GI tract showing the relationship of the large intestine to the hepatobiliary system, kind of hiding the pancreas and the gallbladder and everything else because they're actually not on this diagram, but it's more just to show where the large intestine kind of sits in relationship to where the liver would sit from that picture. And then we have another one as well later on. So cholecystitis is inflammation of the gallbladder. It affects a lot of people, mostly in affluent countries. Table 59-1 in your IGI 8th edition is on page 1215, so 1215, and that is risk factors for cholecystitis. So that's a good one. Acute cholecystitis is more common than chronic cholecystitis. Sorry, I keep saying cystitis, and that's bladder. Acute cholecystitis is more common than chronic cholecystitis. There are a couple different kinds of cholecystitis, acalculous and calculous. Calculous cholecystitis is the most common type, and that is from a chemical irritation and inflammation as a result of gallstones. And the medical name for gallstones are cholelithiasis. Chole, gallbladder, lith, L-I-T-H is stone, and then SIS is inflammation, so inflammation of the gallbladder due to stones. So cholelithiasis, gallstones that obstruct the cystic duct, gallbladder neck, or common bile duct. When the gallbladder is inflamed, the bile gets trapped and then it's reabsorbed into the gallbladder, and that essentially irritates the gallbladder wall because it's digestive enzymes. So that reabsorbed bile, impaired circulation, edema, and gallbladder distension cause ischemia and infection, causing necrosis and gangrene and potentially rupture or abscess. If the rupture is large, you might see peritonitis. Then we have acalculous cholecystitis, which is inflammation of the gallbladder without the gallstones. And that's usually associated with biliary stasis, which is caused by any kind of condition that affects filling or emptying of the gallbladder. So, for example, if we saw a decrease in blood flow or kinking or twisting of the gallbladder neck or the cystic duct, we might see acalculous cholecystitis. Patients who are at risk for acalculous cholecystitis are patients with sepsis or severe trauma or burns, patients who have long-term TPN, multi-system organ failure, people who've had major surgeries, and people who are hypovolemic. Chronic cholecystitis results when there have been repeated episodes of obstruction that cause inflammation. Usually in chronic cholecystitis, we are almost always going to see stones. The gallbladder becomes contracted and fibrotic, and some of the complications that we see are cholecystitis. Of cholecystitis are going to be pancreatitis and cholangitis, which is the bile duct inflammation. These can occur because of backup of bile through the biliary tract, and that's also going to lead to jaundice. So jaundice occurs because bile isn't going in the right place. Bile is supposed to go from the liver to the gallbladder to the small intestine. But if we have any kind of inflammation of the bile duct or plugging of the bile duct, then the bile can't go to the small intestine. It eventually ends up in the blood, which can lead to jaundice and itching and other issues. The incidence of chronic cholecystitis is increased in young, thin women, especially athletic young, thin women like gymnasts and ballerinas. Patients might develop cholecystitis slowly, so it's a slowly developing disease oftentimes, especially when it's chronic, and oftentimes, a lot like the liver disorders, they might not seek treatment until we see late symptoms like jaundice and clay-colored stools, dark urine, and icterus, or that yellow sclera.